Hey everybody, welcome back to the show. Dr. Heidi is here to talk about all of our arthritic woes and how we can help ourselves.
Okay, we were sitting around a table when we were talking about this, and we did a show of hands, and I think out of 6 people that work on our close-knit production team, 5 of us had some form of osteoarthritis somewhere in our body.
We're getting old, Heidi.
Yeah, it's got nothing to do with age.
Dr. Heidi's joining us to talk a little bit more about it. First of all, we're talking about arthritis in general.
Yeah.
How many different kinds of arthritis
Well,
are there?
there's over 100 types of arthritis.
What?
So what most people focus on is the osteo.
only 2.
Oh no, there's lots. Yeah.
Wow.
Really?
There's rheumatoid arthritis. There's lupus. There's gout. There's psoriatic arthritis.
Oh, keep going.
So,
I want to
yeah.
hear all 100 as we go. But osteo is a big one for people.
Yeah,
because
1 in 7 people in Canada have
Now,
some form of osteoarthritis.
Is it a wear and tear?
It is.
predominantly?
It is mostly an overuse wear and tear injury that causes a lot of pain and inflammation. But a lot of times what people don't realize is it's not just older people or aging people that have osteoarthritis. It's a lot of younger people that have wear and tear due to instability in joints or just overuse injury from whatever they're doing.
And really common is wear and tear with the knees.
Yeah, knees are a big one.
Maybe you can talk a little bit about the knee, because you brought a knee.
I did.
It was
It's a
nice.
very small knee.
Brought
I was going to say, is that
weenie.
a bird's knee?
It's a weenie.
It's a weenie, yeah.
A weenie.
Hopefully your knee's a little bigger, a little more
You
stable.
brought on a weenie.
That's the kneecap right there.
That's the patella, the kneecap.
I know my parts.
You do.
Now, where is the most common place that one gets osteoarthritis or wear and tear on the knee?
Inside the joint, you have 2 different, this is your cartilage, and everyone has heard of the meniscus. So you have your medial meniscus and your lateral meniscus. And the medial meniscus, which is on the inside of the knee, tends to wear out more. As you can see, there's a little bit more pressure. And we tend to, when we stand, lean a little bit in more than we lean out, so we tend to wear out the inside a little bit more.
What can we do about this? I mean, diet, I know, plays a huge part into how you take care of yourself in general.
So arthritis is an inflammatory condition, and so the less inflammation you can have in your body, the better off you're going to be in preventing arthritis, which is what we'd all like to do to begin with. So staying away from foods that are, oh, you're going to hate me, but high in sugar. And the
I don't like the
MSG.
sugar.
You know what, Heidi?
That's what we always talk about.
We didn't like this aspect of you before, so this is no surprise.
So once you get arthritis,
high fats, high sugars.
High fats, the saturated fats, lots and lots of red meat. Red meat's not a bad food, but too much red meat just because it is high in saturated fat. Things like aspartame is a huge trigger for arthritis. Alcohol is a big one for a lot of people.
no wonder.
Oh, win or lose, we booze, and apparently we lose.
Now, I found out I have arthritis in my feet, which really shocked me because I was one of those people. I thought it happened to the elderly or people that were...
Shocking, isn't it?
No, it's, yeah. Yeah, but if there were a lot of things I had known before, but now my doctor's telling me calcium supplements and all sorts of other things. What are some of the other things that you can do when you do find out that you have arthritis?
Okay, so definitely making some diet modifications. So you're eating more of the leafy greens, whole foods, trying to stay away from the more inflammatory foods. There are some supplements that you can take. There is a treatment that I do in my practice called prolotherapy, which
and
is
it involves
excellent.
needles.
It does, just little ones.
Okay, what is prolotherapy? Because it can be very beneficial for people that want to maintain a level of activity but are struggling a little bit with some
So I work
slight
a
pain.
lot with athletes and people that are just active in their work, so a lot of repetitive use injuries. And so what prolotherapy does is an injection of dextrose, which is a concentrated sugar, and procaine, which is a local anesthetic, and you inject it into the joint. And what it does is it actually encourages regeneration of soft tissue. So cartilage, ligament, tendon.
Interesting.
Unfortunately, in joints, there's not a lot of circulation.
Yeah.
So you have a stagnant area, you have an injury, and you need blood flow to heal an injury. So in something like a knee, you're not going to be getting that blood flow, and that's why you have a hard time regenerating new tissue.
It takes so long for
So
them
is
to
this
feel
something
better.
you get on a regular basis? Say that you did choose this treatment, and what's the recovery time, and how often would you go?
So it depends on the person. Typically what I find in my practice is anywhere from 4 to 6 treatments. For someone that's got a low-grade inflammatory osteoarthritis, 2 or 3 treatments often do it for the knee. So what I do is I just, if you'll pass me my needle, I just gently, very gently is the key word, is you just inject into the joint from the lateral side and from the medial side.
See, this looks so casual right now, but it's got to hurt a little bit.
It does hurt a little bit. But if you have arthritis, you have people that come in that are looking at a knee replacement versus, 10 years, another doctor says if you don't do something, you're going to have a full knee replacement in 10 years.
And you're saying a couple days recovery time if you do this?
Usually it does instigate a flare-up. So what it does is it pushes you from that chronic low-grade inflammatory response into an acute inflammation. And what acute inflammation does is it brings in the healing factors from the bloodstream. So it encourages healing.
How important is intelligent, moderate activity to long-term, sort of living with osteo or any other form of arthritis?
Well, activity is extremely important. You want to have good muscle tone. Otherwise, what you're doing is you're putting more pressure on your joints. So the more pressure you're putting on your joints, the more wear and tear you're going to have.
That's always a tough one for people. I know some people that have experienced it in my life, that your initial instinct is to back off because it hurts.
Yeah.
But that's almost the exact opposite
of
what
because what you do is if you hold a joint immobilized, you're getting absolutely no flow in there and everything just kind of hardens up. It's like cement almost. It starts to harden up a little bit. So what you want to do is you want to continue doing moderate exercise. And the good activity for someone who is suffering from arthritis is a non-impact. Swimming. It's the marathoners, sorry Mike, but the marathoners that have a really hard time with the wear and tear because you're running for 4 hours, well in your case 2.5 hours.
In high heels.
Oh, 2.5, that's way
You're
too
sprinting.
Slow. Go on.
But yeah, it's, if you're doing that long-term repetitive activity, so your word moderation was a good one. It's that moderate, like you have to find your happy medium where you're not stagnant, but you're also actually
I do have a little bit of osteoarthritis, but it's from wearing lifts more than anything. It's not so much the running, it's the trying to get an extra little bit of height in there. So how does the consultation work? People set it up with you, come in and talk about it and get an idea what their
I do an orthopedic assessment, so I make sure that it's a good treatment for them. And it's not the only treatment that there is. There's a lot of different things. I don't just do prolotherapy with people.
Yeah, you talk about
we work on diet, we work on weight loss.
Naturopathic.
Yeah, if someone comes in and they're overweight, adding 10 pounds, people that gain 10 pounds, often at menopause, women will gain 10 pounds. It's kind of a nature's way of adding security in case you get sick later on in life. And all of a sudden their knees go out, they have arthritis. But that 10 pounds can trigger the arthritis because it's all that extra weight on a joint. So even something as small as a 10-pound weight gain,
so like
10-pound weight loss will make a big difference.
Medicine, it's about treating the whole, not
not just.
Thank you so much, Dr. Heidi. If you'd like to have a consultation with Dr. Heidi, you can check her out. There is the information for you on the screen for any kind of naturopathy that you're interested in. And of course, she does treat arthritis like we were just talking about.
And if you want to hear about my personal account of the downside of wearing lifts in your shoes for 30 years, you can just check out my blog. Thank you, Heidi.
Thanks,
Appreciate
Heidi.
it. We're gonna take a break. I'm gonna recover from embarrassing myself, and we're gonna come back with lots.